Wednesday afternoon, and nice to be with you here on 90.3 FM. You're listening to Helping Seniors of Brevard. As we get things underway, I'm John Harper, and let's check in right now with our host of Helping Seniors of Brevard, along with the executive director. He's one and the same, and we're talking about Kerry Fink. Hi, Kerry.
Hey, John Harper. Hope you are doing well on this Wednesday afternoon. It's another great day to be in Florida, and we are so excited. It's our weekly lunchtime gathering for the Helping Seniors radio show with good information to help you develop your aging plan. So we want to welcome everybody who's tuning in on 90.3 FM, WEJF radio, and also those who are joining us online at WEJF.net. And also a special thank you to those who end up listening after the fact, because as you know, we make all these programs available in our archives in the Helping Seniors of Brevard.org website, helpingseniors.brevard.org. You can also find the collection of all these programs actually, and TV shows and so much more on our Helping Seniors YouTube channel, which is Helping Seniors of Brevard, and also on our Facebook page, which is Helping Seniors of Brevard. But we're here on a very auspicious occasion. Tomorrow is Veterans Day, and we're going to be, we want to celebrate and thank those who have given service to our country, and that really includes you, John Harper, and Jim Votro, who are there in the studios. How are you guys doing today?
Well, we thank you very much, Kerry Fink, for that. We appreciate that, and we're very happy to help celebrate Veterans Day. It means so much to the men and women in our country who have served in the armed forces, and you're about to introduce a very special segment that I think our audience will really enjoy. Yeah.
Just before we get to that, John, I wanted to actually take a moment and honor our guest today. Is a long time friend of the Helping Seniors Radio Network, and he too has served our country with distinction. That is none other than Dr. Lee Sheldon. How are you today, Dr. Sheldon?
Good, Kerry. How are you?
Doing good, and I know
we're doing Veterans Day. Actually, it's interesting as we get older. I get more of an appreciation as to how much that means, and how much that means to. Yes, I was in the service. I was in the service as a dentist, but how much that means to all of us, and we get a greater appreciation as for some reason. I remember it was just a few years ago that I had the opportunity of going to Normandy and taking part in a ceremony. And of course, they called the veterans forward. And that's probably the most significantly emotional experience that I've had with regard to the service and what people did. What soldiers did in order to be able to protect our freedoms. So it's a big deal. It's a big difference,
it's good to honor
everybody who's celebrating tomorrow. You all know veterans, and thank them for their service. They did and continue to do a lot.
They allow us to continue to live free. So thank you to the three gentlemen who are in the studio today, John Harper and Jim Votro, and also Dr. Lee Sheldon, who's our guest today. But I also want to call out and honor our president and founder of Helping Seniors, Joe Steckler. He's served in the Navy. He was a submarine commander in the Navy, and so I do think we take it for granted. And actually, Dr. Sheldon, we're going to open up the show with a special presentation of the national anthem. So if we've got that ready, we'll go ahead and move forward with that.
To For the ramparts we watched were so gallantly streaming, and the rockets red glare, the bombs bursting in, through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the on the shore dimly seen, through the mist of the deep, where the foe's haughty host in dread silence reposes. What is that which a breeze o'er the towering steep, as it fitfully blows, half conceals, half discloses, dark ashes on gleam of the morning's first beam. In the glory reflected, now shines on the stream. 'Tis the star-spangled banner, oh, long may it wave o'er the land of the free and the home of the freemen shall stand between their loved homes and the war's desolation, blessed with victory and peace. May the banquets you bound raise the pardon and may preserve God's nation, then conquering us where the cause is just, and His name our motto in God is our trust. And the star-spangled banner in triumph shall
All right. It's the Helping Seniors radio program right here on 90.3 FM, WEJF. And, you know, we are honoring our veterans. We have two in the engineering booth, John Harper and Jim Votro, and our president and founder of the Helping Seniors organization, Joe Steckler. He served his career in the U.S. Navy. In fact, that's how he got his love for seniors, by the way. His last command, he was a submarine commander earlier in the Navy, but his last command was actually, he was in charge of the Navy's retirement home in Gulfport, Mississippi. And then, of course, our guest today on the radio is none other than Dr. Lee Sheldon, who actually got his training. Dr. Sheldon, I'm looking at your website. You've been proudly serving Melbourne and Brevard County since 1980, but you got your start in the dental side of things going back to the Army.
Yeah, it's true. I graduated from dental school in 1975, and then I spent 1 year in a general practice residency at Fort Sill, Oklahoma. where I rotated among the different specialties. And at Fort Sill, they had multiple specialists in each of the specialties, so it gave me a good background there. And then I was fortunate enough to go to the Army War College at Carlisle Barracks, Pennsylvania, where I was a general dentist for 2 years, serving with 3 other general dentists. Great opportunity to be at the Army War College. We're seeing the senior service people, those people who are going to school for a year after having dedicated their careers to the military service, primarily the Army. And they had been in service for 14, 16 years, and they were spending a year in order to prepare for the next part of their careers. About 25% of the people in that class would go on to become general officers. So what a great experience for a little kid dentist to be able to serve those people. And so it was a great 3 years, and it gave me the opportunity to decide that, in fact, I wanted to become a specialist, that I wanted to become a periodontist. And so I went back to school after leaving the Army after 3 years and spent a couple of years training at University of Connecticut, and then I've been here since 1980. So it's been a great time.
Yeah,
Continues
and
to
I
be a
was
great
going to
time.
say, we've done a lot of radio shows and TV shows along the way, but I remember that, along the way in your career, you were instrumental in actually establishing you were one of the first places here that even was working with dental implants and things like that. And so during your career, you've really introduced a lot of advances to technology. And I know some of this stuff that we're going to talk about on today's show actually kind of tags into that, because the title of our show that we're going to get into is the components of a good dental exam. And I know, Dr. Sheldon, we've had this, usually we wait till kind of the end of it, but I want to bring it right up front. Helping Seniors of Brevard is a nonprofit organization. So we've been serving the community here in Brevard County since 2011. So now we're moving into our 11th year of service of operating the county's Senior Information Helpline. That's a free call from anywhere in the county. 321-473-7770 is our number, 321-473-7770. And again, our president and founder, Joe Steckler, he wanted to establish that. He'd already finished a lot of great work with the Brevard Alzheimer's Foundation. He created the Joe's Clubs, which are those daycare centers to help caregivers with their seniors so that they can actually get a moment if they have to go to work or do some other things or things like that, and really created that. But he said, Kerry, there's more that needs to be done to help seniors of Brevard County. So he established Helping Seniors of Brevard, and since that time, more than 10 years ago, we've helped more than 4,000 families free of charge by getting them connected to resources and things that help them. And Dr. Sheldon, you go back with Joe from before there was actually a Helping Seniors. You were the guy who actually got him onto radio to start with. But my point in all of that kind of background is that one of the fundraisers that helps us keep the doors opening, and you're so kind to do it, you have a program where people come into your practice and they literally make a donation to Helping Seniors, and they get their entire, and I mean very complete, first exam at no charge other than the donation to Helping Seniors. Can you just quick give a comment about that? But then we're going to go into how important the exam is, because it isn't just like open your mouth and say, "Oh, you guys get into all kinds of parts of it."
Yeah, as far as the public service, yeah, make a donation. Just bring a check with you and write a check for $50 or more. We'll take more.
We'll take more.
And to Helping Seniors of Brevard, all of the money goes to Helping Seniors of Brevard County. And you get the X-rays, the CT scan, the full examination. It's a 2-hour experience in our office, all for that $50 or more donation.
Yeah, and I think one of the things that you've impressed upon me over the years is that you've explained that, while it's a great deal for a patient coming in because they get to walk in and really understand where they are with their mouth situation, but you've also explained it's very helpful to you and your team. It's actually your son who has been named, may I say, one of the top 40 dentists under 40 in the United States of America.
That's my boy.
and then also a Dr. Michelle Furtado, who is like yourself. He's a periodontist, and so you kind of have the ability to get a lot of work done within your practice. But you've explained to me that you really want to have, when somebody comes in, you want to have that really solid first exam, because that really lets you, with the CT scan, you can really get a handle on what's going on. And so my first question to you, actually, specifically though, is, it's funny, whenever we come into a new situation like that, they always hand you this clipboard and they say, tell me all this stuff about yourself. And some of it's pretty obvious. They want to know your name, your phone number, and things like that. But then they ask you, they want to know about your medical history. And so, the obvious first thing when you're filling out the form, you're going like, well, he's just going to look at my mouth. Why does he need to know all that stuff? So explain. It's true.
And I do get that. I don't get that question as much now as when I was a little kid in dentistry. but maybe the staff does. Maybe they get the questions before I get it, because one of our staff members is going to be greeting the patient and spend 40 minutes with the patient, include going over the medical history. So maybe they get that. People don't realize, or maybe do realize, is that we're injecting medications in the mouth. We're injecting medications to get you numb. And certainly those medications that we're injecting can be influenced by the medications that you might take. But when you come to dental decay, there are over 500 medications that cause dry mouth. And when your mouth is dry, then the mouth becomes acidic, means full of acid. And so you may be more prone to decay than the other individual. Another individual. So what does that mean? If you're prone to decay, let's assume you have lots of tooth decay, and we've ruled out sugar as being a cause of that, then our choice in how we treat you may change depending upon the medications you are on. So, for example, if you keep on getting more and more decay, the last thing you want to do is to spend money on root canals and crowns, when in fact, once you do the root canal and the crown, you're still going to get decay, because the crown doesn't stop decay, it only restores the decayed portion of the tooth. And so we don't want you to continue to have dentistry after dentistry after dentistry that's going to fail. And so for you, you might be it might be better for you to get a dental implant than to restore the tooth. And I'm only giving that as an example. As you know, we've spent a lot of sessions here talking about saving teeth, not doing dental implants. Even though we're known for dental implants, we pride ourselves on saving teeth. But then there are other things as well. We've talked on this show, and almost anybody who's listening to this show has read the connection between periodontal disease and other systemic diseases. So you've got periodontal disease and heart disease, periodontal disease and diabetes, periodontal disease and Alzheimer's disease, all of which have a closer and closer and closer relationship. So if we're seeing that, then in fact we've got to be aware of what it is that what other diseases you're being treated for, because we may very well want to interface with your physician to decide what the best approach would be. For some people, we may even want to change medications in order to be able to help improve your periodontal condition. Or we may want to monitor, we may want the physician to monitor more closely what occurs, because we've had lots of patients who've had dental infections, and as a result of getting rid of their dental or periodontal infections, their diabetes got better. And so we need a close monitoring in that regard. The mouth is attached to the rest of the body. In fact, the mouth is the inlet to the rest of the body. So we do need to have a good idea as to what's going on medically, so that we can best serve you.
In fact, fairly recently, you and I did a radio show together where you were stating some groundbreaking research. I think it was coming out, I want to say it may have been coming out of Taiwan, but I'm not sure. But I remember the point of the study was really that you were discovering or reading that the data is now showing that treating the periodontal disease is actually a plus factor in heart health. And that was really, we don't necessarily think, we just think, oh, I've got a toothache or something, but it really is all tied together.
That was an exciting study. Of course, it was only looking at insurance codes. And so, there's a certain amount of objectivity of insurance codes because you're seeing what patients are being treated for what. But yes, there was a positive correlation between treatment of periodontal disease and reduced expense for heart disease. So it's got to be researched further, but this isn't the first time we've seen that. We've seen that in the United States as well with one of the insurance companies. And so, yes, for years we separated the mouth from the rest of the body. Now we're finally understanding that, in fact, the rest of the body, and particularly periodontal health, can influence your general health, and if periodontal disease is treated in a very positive way.
So I mean, I think we're sort of like tagging into this topic, like, we show up for our dental exam, like we talked about, and then the first thing you want to know is a little bit about the medical history. I was reading some notes here, and you said also that certain medical procedures would have some impact on whether you would choose to have antibiotics before receiving dental care. That it may have an impact. It may cause you to say, hey, this would suggest to me that you should take an antibiotic before we see you, or something like that, right?
Yeah, it's true, because when we put body parts, or when we replace body parts, those body parts can actually catch bacteria. Understand that when we're cleaning below the gum line, of course, we're trying to clean the bacteria off the root surface. But whenever you're placing anything below the gum line, you're going to put bacteria into the bloodstream as well. So once the bacteria goes from the tooth into the bloodstream, it circulates all around the body. Well, if there's some areas where that bacteria can catch and accumulate, it could cause some damage. And so with heart valve transplants, particularly artificial heart valve transplants or hip and joint implants, these are areas where we want to be a little bit more careful and prescribe antibiotics in conjunction with a dental procedure in order to be able to help reduce the possibility of damage to those implants or transplants that might have been done.
I was thinking as you're talking through this, because basically we're talking with Dr. Lee Sheldon, who is with Solid Bite Dental, a long time. Sheldon and Furtado is actually the name of the practice, because it's your son and Dr. Michelle Furtado, who is, your son is a general dentist, Dr. Matt Sheldon, and Dr. Michelle Furtado is a periodontist, and of course you're the consulting periodontist and kind of founder of the practice. But we're talking with you today about learning what makes up a good dental exam, and so this is the first part of it, is you getting to understand the medical history of the patient so that you can best help them determine the correct care going forward. And you guys are famous for your work here in Brevard County, not only about dental implants, but periodontics. You do full dental rehabilitation, general cosmetic. It's like you're involved in every aspect of it. And I think, to me, one of the things that's impressive is the fact that you take so much time with a patient at the outset to help them get a good treatment program. So we're going to be coming up on our mid-show break, and before we get there, I want to make sure if somebody wants to take advantage of that, you write a check for $50 to Helping Seniors, take it into Dr. Sheldon's office when you make that appointment, and then you get your complete first exam. How do people get in touch with your office to make an appointment for that?
Our office phone number is 321-259-8000.
All right. So we are going to be continuing with the mid-show break, and then we're going to be right back, and we're going to continue this dialogue of what to look for in a good dental examination. More soon on Helping Seniors Radio.
And you're listening to Helping Seniors of Brevard, heard every Wednesday afternoon, 12 noon to 1 o'clock, right here on 90.3 FM. Right now, let's get back to more of our show and the great conversation led up by the Executive Director of Helping Seniors of Brevard. Here's Kerry Fink. Kerry?
Thank you, John Harper, and thank you, listener, for staying with us here on Helping Seniors radio program. It's a every Wednesday lunchtime gathering around 90.3 FM WEJF radio, and also thanks to our listeners tuning in. Actually, they could be global for that matter at WEJF.net. And so also thank you if you're catching the rebroadcast of this. We make all of these radio programs, TV programs. We make sure they're available in the library so people can call them up by topics. And if you're looking for the topic of today's radio show, we are talking with Dr. Lee Sheldon, who is the founder of Solid Bite Dental Sheldon and Furtado is the name of the practice. They're right there on Sarno Road here in Melbourne, Florida. And Dr. Lee Sheldon is a longtime friend of the Helping Seniors organization, and we have been talking about components of a good dental exam, and we're going to get right back into that conversation, but we're also taking a moment to honor the veterans, since tomorrow is Veterans Day. And we were talking about this in the first half of the show. Both John Harper, who is not only he's vice president of the Helping Seniors organization, volunteers his time to be on the board and help us with that, but he's also literally Brevard County's longest running radio talk show personality. And together with Jim Votro there in the studio, both of you guys deserve a big thank you for your service in support of our country as veterans. And also the same is true with Dr. Lee Sheldon himself, because he started out in the Army, and in fact as a dentist in the Army. And then of course also our president and founder, Joe Steckler, started out in the Navy. And he was a career guy in the Navy, actually. He commanded submarines, but he also learned a lot about caring for seniors during his last command in the Navy as a captain. He was in charge of the retirement home for the Navy there in Gulfport, Mississippi. And so that gave him a real affection and a feeling of needing to be a strong advocate for seniors, which he and his wife Terry brought here to the Space Coast when they retired over here in Satellite Beach. And so since those days, of course, Joe has been busy. He built the Brevard Alzheimer's, and 10 years ago, he got us all started on the Helping Seniors effort. And so we really want to thank the veterans for their service. And so before we continue with the show, we thought it would be really appropriate to share this clip. This is a great clip. You guys remember Red Skelton. This is an American classic. Let's roll it.
Well, I remember a teacher that I had. Now, I went through the 7th grade. I went to the 7th grade. I left home when I was 10 years old because I was hungry. And I used to, this is true. I work in the summer, I go to school in the winter. But I had this one teacher. He was the principal of the Harrison School in Vincennes, Indiana. To me, this was the greatest teacher, a real sage of my time, anyhow. He had such wisdom. And we were all reciting the Pledge of Allegiance one day. And he walked over, this little old teacher, Mr. Laswell was his name. Mr. Laswell, and he says, I've been listening to you boys and girls recite the Pledge of Allegiance all semester. And it seems as though it's becoming monotonous to you. If I may I recite it and try to explain to you the meaning of each word. I, me, an individual, a committee of one, pledge, dedicate all of my worldly goods to give without self-pity. Allegiance, my love and my devotion to the flag, our standard, Old Glory, a symbol of freedom. Wherever she waves, there's respect, because your loyalty has given her a dignity that shouts freedom is everybody's job. United. That means that we have all come together. States, individual communities that have united into 48 great states. 48 individual communities with pride and dignity and purpose. All divided with imaginary boundaries, yet united to a common purpose. And that's love for country. And to the republic, a state in which sovereign power is invested in representatives chosen by the people to govern. And government is the people. And it's from the people to the leaders, not from the leaders to the people, for which it stands. One nation, meaning so blessed by God, indivisible, incapable of being divided, with liberty, which is freedom, the right of power to live one's own life without threats, fear, or some sort of retaliation. And justice, the principle or qualities of dealing fairly with others. for all. For all. Which means, boys and girls, it's as much your country as it is mine. And now, boys and girls, let me hear you recite the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, indivisible, with liberty and justice for all. Since I was a small boy, 2 states have been added to our country, and 2 words have been added to the Pledge of Allegiance: under God. Wouldn't it be a pity if someone said that is a prayer and that would be eliminated from schools too?
That's Red Skelton as we're honoring our veterans on Veterans Day, which happens actually tomorrow. So on the Helping Seniors radio show. And by the way, it's not too late for you to head out today. The 2021 Mega Senior Expo is going on right now at the Wickham Regional Pavilion. It's going on 10 a.m. to 2 p.m. And Nina Varuso, who organizes these wonderful events, is actually doing a special salute to veterans, the hometown, saluting our hometown heroes. And there's more than 60 vendors out there. It's free admission. They're going to do a veteran salute ceremony. There's giveaways, prizes, food, refreshments. And there's still time to get out there and join it. Look for Nancy Deerdorf is going to be there with our Helping Seniors organization. We've got a table there. So we look forward to welcoming you out at the Wickham Pavilion there at the park. 10 a.m. to 2 p.m. is the time, so still a little over an hour left to get out there and enjoy it. Brought to you by Senior Scene, Health First, Care Plus, Vitas Healthcare, Humana, VNA, and more. And so it's just a great moment to take a moment. If you see a veteran, thank them for their service. And thank you, Dr. Sheldon, for your service.
It was a good time, I'll tell you. Getting out of dental school, and because I got out of dental school young, I was 24. And joining the Army, which my father, by the way, was a veteran. He served in World War II. It gave me an opportunity to have a better appreciation as to what the military was all about. After all, I graduated from a liberal college, so during the Vietnam War days, and so you have one influence at that time, and then you get some grounding once you go into military service. Even though I was a dentist, and so I was treating, that's what I was doing, is treating patients just like I do now. Well, hopefully I do a little bit better now than I did then, but I was pretty good then too.
Sort of experienced now.
Yeah. So, but you have an appreciation for what veterans have done and how they served and some of the things that they did. I had one patient who was he was a paratrooper, and his chute didn't open. And he was my patient a few years later, and the rehabilitation that he went through, and still he was on active duty. He was able to continue on active duty.
Wow,
that's dedication. And what he said when I talked to him was, what's it like? You were in wartime. And even beyond what occurred with the parachute not opening, and the way he said it was, I trained for a job, and now I had an opportunity to practice what I trained. Some people would look at that one way. I looked at it in a way of professionalism.
Yes.
Whether you're a soldier, whether you're a broadcaster, whether you're a dentist, whether you're anything, there are professional ways in which you can carry out the work that you do. And to see him, and I liked him a lot. As a matter of fact, he came down and helped me with my Florida board examination, because in Florida boards you have to treat patients in front of the examiners, and he helped me. The professionalism makes all the difference in the world. those of you who see somebody, and whether it doesn't make any difference what the profession is, if there's a certain amount of professionalism involved, then the patient or the customer understands that this person actually takes his or her work quite seriously.
Yes.
That it's not seeing you for a paycheck. It's seeing you to help you and to help you achieve your goals. And I think that's also, I'm segueing a little bit here, but that's
Yes.
also part of this examination that we do. Examination. Well, why even talking about examination? Do you know I teach examinations to other dentists and other periodontists, and I have I have a couple of clients who see us for consultation, and we were teaching them the examination that we do. The reaction that they got from their patients, for them, was absolutely mind-blowing. They said, I've never had an examination like that.
Right.
Professionalism. You're not there to assess something in order to be able to create a certain number in your checkbook or in your income. You're there to create solutions, hopefully permanent solutions, or at least long-term solutions for your patient or for your customer. That's what professionalism is all about.
So well put. And I was thinking about what you were saying, Dr. Sheldon, because I know, you have even helped practices along the way how to actually operate their dental practices, giving them guidance on how to set that kind of a tone in the office and to how to make sure everybody is operating at their peak level. But and that it really is one of the things I think is impressive about you and Dr. Matt Sheldon and Dr. Michelle Furtado. You guys always, and I'm just speaking from personal experience, you guys really are looking after our best interest. But I wanted to kind of come back to our topic of what makes up a good dental examination. In the first part of the show, we said, we asked the question, like, you're always asking us for our medical history, and you gave kind of an explanation of that. But usually the next thing that happens is they come along and they say, oh, we're going to take a full mouth x-ray. And I know as a patient, I'm thinking like, well, I don't think I have any cavities or anything. But then you take it like another step because you say, no, we're going to do a CT scan. What I know, first of all, that's got to be costly to put all that together normally, but why is that so important?
Well, let's take the full mouth series of x-rays, because people say, I don't want to have x-rays taken. Frankly, we don't want to take x-rays either. We don't. And those are the individual x-rays, and we take 20 x-rays of your mouth, 20 individual x-rays of your mouth. Why do we do that? Because it's the only technology we have available right now to be able to see your teeth and to see your bone. We can't see cavities between your teeth unless we have x-rays. So it becomes so important in terms of looking at bone levels and relative bone levels for periodontal disease. It allows me to see that. It allows me to see. We've done our programs on fractured calculus, meaning that it's hard accumulations of material on the root surface. If I can see calculus on your x-ray, you've got something that's really, really, really significant. So it gives us a visual with the only technology that we have available, and unfortunately that's radiation. Now the good news is that we've been able to reduce the amount of radiation as we've been able to use computer sensors to be able to take your x-rays. So we're using computer enhancement so we can reduce the radiation. I hope there's a time we can do this without radiation at all. But radiation safety, the amount of radiation that we use for dental x-rays, is minuscule by comparison with other x-rays that are taken in the body.
Wow.
Okay, so we take those x-rays and we get the information with regard to cavities and bone levels and calculus, and sometimes we can see other things like abscesses, which are trapped infections in the bone. Why do I take a CT scan? When people are seeing us for dental implants, I have to make sure that there's enough volume of bone in order to put the dental implant in place. Can't tell you how many times a patient has come to me and has said, my dentist says I don't have enough bone for dental implants. And of course, my question is, do you take a CT scan? Do you take a CT scan? The answer is invariably no. So when we take a CT scan, I can get a three-dimensional idea as to where the bone is and decide whether, in fact, you do have enough bone. Most people do. But you can't see it in any other way. You need a three-dimensional representation. And that's what a CT scan does. It gives you a three-dimensional rendition of what your entire jaw is and allows us to see whether and where implants can be placed. But there are other things as well. There are a number of people who see us for gum recession. And people say, well, I have weak gums. No, you don't. Sometimes you have very, very thin bone. And within a CT scan, we can see how thin the bone is and make a better decision as how best to treat you. For people who are getting orthodontic treatment, you're going to get braces. Sometimes the bone is so thin that it would be risky to move the teeth through the thin bone. And maybe we need to do some bone grafting in order to be able to allow the orthodontist to move the teeth in the direction that he or she wants to move them in, and still make sure that we have good bone support when we get all done. You can't tell that unless you take a CT scan. So, the final thing is abscesses. We talked about trapped infections. People need root canals. I can see far many more abscesses, and some of these abscesses or infections are causing health risks, particularly risks of sinus disease. I see that a lot, where if we're able to diagnose an abscess that may be perforating into your sinus or is about to perforate into your sinus, we can actually stop a sinusitis from occurring by getting that treatment done, usually a root canal, before that occurs. I couldn't get along without a CT scan. Every one of our patients get a CT scan now because I'm able to catch infections early and help a lot more patients.
Well, and the other thing I notice is when you as a patient are sitting in the dentist chair, you guys have the ability to put up on the screen it's right there in black and white. So when they're trying to explain to you, like, well, this is what we're seeing that you need to have done, you as a patient have sort of a visual understanding of why what you're being told makes sense. It helps you to visualize it. I mean, just from the patient side, I think.
It's true. People are still fascinated by this. We've been doing it well over 10 years. They're still fascinated by the fact that I can do a virtual surgery on the computer. I can show them where the implants are going to be placed, what the teeth are going to be like. And of course, that helps me as well, because sometimes the bone doesn't line up with where the teeth are going to be. I can determine that in advance so that sometimes the implant isn't the right decision. In fact, often the implant is the right decision. I can determine in advance whether, in fact, the location of the implant is going to be beneficial to the patient, or whether bone graft is necessary. And if bone graft is necessary, is it better to do another service or another procedure? But that's advanced. The software has advanced so much that not only are we able to do virtual surgery, but we're able to prepare a surgical guide, something that will snap in over your teeth, which directs the drill, the implant drill, in the exact direction or in the exact trajectory, the exact position where we've located the implant on the on the software. So essentially, we can do the virtual surgery and then create a surgical guide to make sure that everything lines up exactly the way it did when we did the virtual surgery on the computer.
Yeah, it is incredible the technology that's involved in this, and I think you're doing a great job of explaining the components of a good dental examination. And so while we're rapidly getting up to the end of the hour, I want to make sure that we leave folks with the phone number and contact information, and again to kind of restate the amazing, it's a very big blessing to us as a 501c3 Florida nonprofit helping seniors of Brevard, but basically, and you explain it better than I do, but I'm going to try to summarize it and say, you call up, you make that appointment, say I want to do my initial appointment, you bring in your check for helping seniors, give at least $50, then your initial, that 2-hour intensive dental exam is included with that. You just you just giving your time, but to help us with that, but also to help the patient get a serious understanding of exactly where they are on everything.
That's all you do, and you have the advantage of 3 doctors. As a matter of fact, Tuesday afternoon is our doctor's meeting, so we take our complex patients, and Tuesday afternoon is when we meet and discuss our complex patients and how we can best treat them. This is, I've been here for a long time, but and I was a solo practitioner for most of my career, but to have all three of us planning and deciding who can do what and what the different alternatives there are for patients it makes a big difference to us. And if it's going to make a big difference to us, it's going to make a big difference to the patient as well. So yeah, all you have to do is bring a check with you, and you'll write a check for $50 or more to Helping Seniors of Brevard, and they get the money, and you get what we hope is the best dental examination you've ever had.
And how do they reach your office one more time?
Call us at 321-259-8000.
So one more time, 321-259.
259 8000.
8,000. We're talking with Dr. Lee Sheldon, who is a expert periodontist, Solid Bite Dental, right there on Sarno Road. Been here serving Brevard County since 1980 and served our country. And thank you, sir, in advance. And thank you, John Harper, in advance. And thank you, Jim Votro, in advance of Veterans Day. And thank you, Joe Steckler, our president and founder, in advance for all your service to our country, and as we honor you guys on Veterans Day, which is tomorrow. So again, as we're getting to the end of the show, we're going to be out at Wickham Park Pavilion until 2 p.m. today with the Mega Senior Expo. That's also honoring veterans. It's absolutely free. Lots of good information and things to pick up out there. So on behalf of Joe Steckler and our entire Helping Seniors of Brevard crew, if you ever need any help, reach out to us on our Senior Information Helpline. That number is 321-473-7770, 321-473-7770. We're here to serve you on that. And also, one last thing, jot down helpingseniorsofbrevard.org. If you've got access to the internet, that is a great website to remember, helpingseniorsofbrevard.org. You can find this radio show, lots of TV shows, lots of great articles and things that you can grab a hold of that will help you as you develop your own aging plan. So for this edition of Helping Seniors Radio, on behalf of Joe Steckler and our entire team, we're going to leave with a salute. This is as I understand it, it's the 246th anniversary of the U.S. Marines, and so we're gonna sign off with a great song of tribute for that. So till next week, we'll see you then on Helping Seniors Radio.
He sat in that long line of barber chairs, and the sergeant asked him, "Son, would you like to keep your hair?" And he said, "Yes, sir," as he heard those clippers buzz and hum. And the sergeant said, "Well, hold out your hands, 'cause here it comes. Semper Fi, do or die. So gung-ho to go and pay the price. So here's to leathernecks, devil dogs and jarheads, Paris Island in July. Semper Fi." I sleep in my bed instead of a foxhole. I've never heard my boss tell me to lock and load. Ain't no bullet holes in the side of my SUV, 'cause the kid next door just shipped out overseas. Yeah, simplify, do or die. So gung-ho to go and pay the price. So here here's to leathernecks, devil dogs and jarheads, and Paris Island in July, sympathize. To the few that wear the dress blues with haircut high and tight, and proud to be the first ones in the fight. Yeah, sympathize.
Hey, how you guys doing on ammo?
Oh, sympathize. Do or die. So long for to go and pay the price. So here's to leathernecks, devil dogs and jarheads.